Dental therapy really aligned well with my beliefs and values and what I wanted to do in my career. I really wanted to help people. And since dental therapy focuses on helping the underserved populations, I really thought it was a good fit for me.
I have worked and lived in several countries, and everywhere there is a lot of disparity, specifically related to dental. Bridget Cooper, when she approached me that they are starting a new program teaching dental therapy students, that's when I got interested, and then I started reading and looking into dental therapy, and I came to know that um, these are kind of like a mid-level practitioners similar to nurse practitioner, where they can do the routine restorative care, preventative care, pulpotomies and simple extractions.
My vision for dental therapy was really to work much like the models in medicine, like a physician assistant and a nurse practitioner, but to really build on the foundation of someone who is a dental hygienist. I really wanted to establish this new interprofessional member of the team that would really be educated and trained to the same standards that a dental student is for the scope of practice they would deliver.
As part of developing the program, we went to various places around the world that had dental therapy programs. I did go to the one that went to England. We went to a couple dental schools, including the dental school in Sheffield, England. And what I was impressed about with that program was the dental therapists and the dental students were mixed together. They weren't identified in any way, so you couldn't tell, looking at a room full of students doing restorations on mannequins, who was a dental therapist and who was a dentist.
Just knowing that other parts of our world, developed countries, have been using dental therapists for decades should be significant in terms of, the United States. Minnesota in this case was not trying to reinvent the wheel, but instead build on a practice that was very successful for a very long time.
There was a lot of resistance against dental therapy, because it was just starting out and really had just finally gone through the legislature. The first class were sort of waiting, to hear that they actually could practice and stuff. So we were just sort of that first class that knew we could go out, but it was just a lot of resistance.
Being part of the first class was stressful and exciting, kind of all at the same time.
I hadn't worked in community health or public health at all. I'd always been in private practice as a dental hygienist, but it just made so much sense to me that I was really excited about it. Super excited that it came to Minnesota.
I would say the controversy in the very beginning and throughout and to the present date doesn't surprise me. But we've been doing dental therapy now for over 10 years, and in those 10 years I've been on the board of dentistry for 7 years, serving as president, and never had any issues of quality that have come forward from consumers whatsoever.
The nature of the concerns were largely the same. It's hard to know whether it's kind of personal self-image, concern about the profession, concern about business strategy. It always comes forth as concern about the patient, but I'm not sure at its core that that's what it is.
No, even in the research, it was well documented there were no safety or quality concerns. There has been no reported safety or quality complaints right now of care, quality of care complaints.
I have heard of no complaints or any problems with working with dental therapists at Apple Tree Dental or elsewhere. Dental therapy is absolutely 100% safe. I would trust a dental therapist to do my own dental work as well as dental work for anybody in my family.
Once clinics hire dental therapists, they really see that we are well educated, that we do fillings just as well as them or even better, because that's what we do all day long, and we really care about our patients.
I could see a lot of controversy with dental therapy previously, but as more states are considering legislation, so the dental therapy is getting more authorized. So more and more states are looking into it because of shortage of dentists and the need for more practitioners to provide the basic treatment for patients.
I've seen quite a bit of change in dental therapy altogether, but then also for my own clinical practice. I feel when I first started out, I was really just working on my clinical skills and learning how to be a dental therapist team member. And really it's evolved into much more than that over the last 10, 11 years. And I feel like now I'm able to pursue more of my clinical interests. I've developed my practice philosophies and just gained a lot more autonomy that way. I am just more well-rounded and able to do more as a clinician, but then also as a team member for the whole organization of Apple Tree.
I would say in the last 10 years, I think that the students are graduating stronger. They're having more opportunities to work in clinic.
With our students we've seen here at Metro, we've had a very diverse student class the last few classes, not just diversity in terms of ethnicity, but geographic. We have students, we have one student from Grand Rapids right now, one student from Duluth, and to be able to get these students out into the state is just a great access to care.
All dentists are mostly in the urban areas, and to serve the rural community, I think the dental therapy and the teledentistry plus the dental therapy, I think, would be the answer.
It is so important to advocate for dental therapy in Minnesota as well as other parts of the country, so that as a dental workforce we can really increase access to care. Dental caries, dental disease, and oral health is one of the most needed health services in the country, and so with dental therapy we can really help to expand access to care.
It all boils down to what's your goal. In our case, it's help consumers have access to care.
I really would believe that we'll see over time more and more states adopting similar legislation as Minnesota has, and we'll see this grow exponentially.
Dental access has improved. Dental care is being targeted to populations that deserve it. It's meeting the need. It's very exciting hearing from dental therapists and advanced dental therapists how well they're received in their communities by patients. It's like they're changing. A lot of dentists are more open to it and are asking questions. They're working together. Like I said, every member of the healthcare team and the oral healthcare team is important. It's really fulfilling the goals that were set out. We still have some progress to be made, but we're fulfilling the goals. I think, like I said, it's well worth it, and in another 10 years it'll be exciting to see where we're at.